Good afternoon. I'm Jim Inkster, your moderator, and thank you for being with us for the 57th edition of Ask the Governor from the 56th Governor of Louisiana, the Honorable John Bel Edwards, who's closing out the year with us. And if you'd like to join our conversation, your number is 877-217-5757. It was 9 months ago today that the governor issued his first stay-at-home order amid a pandemic, and of course the world has changed immensely since then. And there are both good signs and not so good signs on the horizon as we close 2020. And before we go to the phone lines, the governor does have a guest who is quite appropriate at these times, and the state immunization director, Stacey Hall. But Governor Edwards, how is it 9 months removed from March 16th?
Well, it's true that we have light at the end of the tunnel, and at the same time, it's a freight train coming at us, and it is also a light that shows us the way to end the pandemic and finally put it in our rearview mirror. We're currently in our third surge. There's no doubt about that. We're well into it. We have positivity that is unacceptably high. We're adding new cases each day at a very high clip. Hospitalizations are the highest they've been since the peak of the summer surge. And in fact, they're almost exactly the same today as they were at the peak of the summer surge. And unfortunately, deaths have increased too. But we've started administering the vaccine this week to healthcare workers, and I know we'll talk more about that. So we have a lot to be hopeful for. But the most important message to the people of Louisiana as we approach Christmas about where we are in the pandemic is to be hopeful, get the vaccine when it's available to you because it's safe and effective. That's how we finally put the pandemic behind us. But the most effective tool for us right now in preserving hospital capacity and saving lives remains the mask because we're not going to have enough allocation of vaccine soon enough for the general population, but we're in the surge. And so we have to reduce the spread now, flatten the curve now, lower the percent positivity, the cases and the hospitalizations. And what we can't do is have a Christmas surge superimposed on the post-Thanksgiving surge that is already superimposed on the fall surge. We just can't afford that. And so I'm asking everyone to please not have this Christmas look like Christmases of past and this holiday period. We need to make sure that we don't travel unnecessarily, we don't gather unnecessarily, and especially bring multiple generations of people together who are not part of the same household. That is the surest way to spread the disease. But we are very, very pleased about the rollout of the vaccine, and it went relatively smoothly this first week. We've received all of our allocations, and Stacey is our expert, and I'll tell you, they've worked extremely hard. She went to the White House with me last week at the invitation of the president to participate in a summit on the vaccine. But she's worked hard with other public sector individuals and groups and private sector folks in higher ed and the National Guard and our partners at the federal government to put together one of the best vaccine plans in the country, which is why we were invited to the White House last week, Jim.
Well, Stacey Hall is with us, and logistically, I know many of our listeners have questions about how this will work, and it is with us now as far as the vaccines. Now, not everybody can get one right now, but that day may come very soon. And Dr. Hall, your thoughts about where we are and moving forward?
Hi, Jim. Good afternoon. Yes, we're so pleased to be where we are, moved from the planning stage to what really matters, actually getting people vaccinated. The amounts are limited. I like to think of it as early doses, and we're going to give those to the priority people. That's healthcare providers to maintain the infrastructure the governor talked about, and then people like those in nursing homes that could get so severely ill they may even die. We're hopeful to have more vaccine to continue to expand in those areas. I do think it'll probably be summer before we have enough vaccine for everyone that wants to be vaccinated, but we're so happy to be where we are and maybe make a change in the pandemic.
What do you say, Dr. Hall, to those who have trepidation about getting a vaccine?
I hear a good bit people say, I want to wait and see how other people do. And my answer to that is we call that clinical trials. They did okay. We already did that. The vaccine wouldn't be here if it wasn't safe and effective. I know sometimes the processes at the FDA and the CDC and the advisory committees that have to go through, but those processes are what has let us have the safest, most effective vaccines that we've ever had in the history of our country. And we really don't want to skip any steps, and we haven't skipped any steps with this vaccine.
Governor, what are your thoughts about getting the vaccine?
Oh, I will get it as soon as and I'm going to, I will tell you, all of the members of my family are going to get it as soon as we're in the order of priority that's being vaccinated. Look, it is safe. It is effective, 94 to 95%. When I say yet, I'm talking about both Pfizer and Moderna. Moderna isn't approved yet, but the data is very promising, and it looks like sometime later this week it will be. But 94 to 95% effective in preventing COVID, right at 100% effective in preventing serious cases of COVID, and we know that it's safe. And so this is how we put the pandemic behind us. It's going to take, I think, a minimum of 70% of the people of Louisiana being vaccinated in order to create you've heard the term herd immunity used for a long time now. But this is actually the smart way to obtain that, is you do it through vaccines. And so that's what I hope the people of Louisiana will do. It is safe and effective. No steps in the process were skipped. And I want people to understand that. Even though it's record time bringing this vaccine online, about 10 months from the start of the pandemic until we had the first vaccine, no steps were skipped. And in fact, rather than just doing all the steps sequentially and taking 6-8 years to develop this vaccine, they were all taken in parallel.
Governor John Bel Edwards has had natural disasters to deal with, and now for the last 9 months he has dealt with a pandemic. We were visiting with him on his 57th show, along with the state immunization officers, Dr. Stacy Hall, and the governor was talking about vaccines when we went to the break, and we've had a listener or two ask when you will get it. You say you will take it, Governor, but do you know when you will actually receive it?
No, I don't. And look, there's a lot of variables in this. The way this is going to work, we won't know as a state until each Friday what our allocation is of the approved vaccines that are going to be shipped out the next week. We're then going to have to place orders. But for the next few weeks, we're going to be working on Priority 1A, which we accepted from the recommendation that came from the Advisory Committee on Immunization Practices, ACIP. And so who's getting it now? The Tier 1 hospital healthcare workers, not just doctors, nurses, and therapists, but certainly them, but also other workers at hospitals, whether they're custodians, food service, you name it, who interact with all of these COVID patients and so forth. And then we also know that as part of this priority, we'll start vaccinating residents and staff of long-term care facilities, so nursing homes and assisted living centers, and EMS workers. And so all of that's going to be rolling out. Right now, we're still on the hospital workers. We plan right now for Moderna to be administered to the residents and staff of long-term care facilities. Not exactly sure when that's going to start. It hasn't been approved yet, but we think the EUA will come out as early as tomorrow. We'll be looking at that to make sure that it is the right vaccine for that population. But sometime before the end of the month, we believe that we will be in our nursing homes administering the vaccines there. And then the follow-on orders of priority will be developed, again, in consultation with ACIP, but also looking to make sure that we're approaching this with equity in mind and looking at our particular hospital population in Louisiana, our COVID census, and what do those patients look like? Because if we're trying to preserve capacity in our hospitals and save lives, we need to be vaccinating first those people who are actually going to the hospital in large numbers. And so we believe that's going to be older people with comorbid health conditions, maybe end-stage renal disease, And at some point after that, Stacy and her team and we're all going to be making decisions about priorities as far as other folks like first responders, school teachers, and other critical segments of our population. Wherever I fit in, that's where I'm going to get when I'm going to get my vaccination, and I'm looking forward to actually being vaccinated.
No, I have not yet because I don't perform direct contact with COVID-19 cases, and I'm not a resident or, a staff member in a nursing home. Those are our first priorities. But I'm really eager for the vaccine to come out, more than for me personally, but for my elderly patients. My elderly parents. They're over 85 and they're at home and they're tired and lonely of isolating. We'll continue to do that through the Christmas holidays. It's going to be really hard, but we are limiting our contact. But I really want the vaccine for my parents, first of all. As soon as the vaccine does become available for me and my risk category would come up, I will be vaccinated.
Your number is 877-217-5757 for Governor John Bel Edwards and his special guest, Stacey Hall. Michael in Baton Rouge. Hi, Michael. You're on Ask the Governor.
How you doing? I want to be afforded the opportunity, if I could, in the common courtesy, to ask a question and make a statement because I've lost relatives. I lost an uncle and an aunt. I take care of seniors, and I've lost 42 seniors I've taken care of that have died. And actually, I don't take care of personally, but I deliver things too. So my heart is just, I'm really having a heavy heart, and I want to say something to make a statement. 7,000 people have died, Governor. We have 16,000 people on ventilators. Dr. Devilberg issued a report more than 2 months ago saying that the mitigation efforts were not enough. The phase we're in now, Governor, is not working. You can go into the...
All right. What is your question, sir? Michael, we have some people waiting. We can't have you on an extended period, but we do want to entertain your question. What is your question, Michael?
Question is,
Yes,
why haven't we taken a step back to a different phase to protect lives and save people? Because what we're doing now is not working, Governor.
All right, Governor.
Well, first of all, Michael, I'm very sorry for your loss, and you're right. We're closing in on 7,000 people who have died in Louisiana from COVID-19. We just now went over 4 million tests, and we're getting close to 300,000 individual cases. A couple of weeks ago, I guess it was 3 weeks ago, we did go from phase 3 back to phase 2, so we did take a step back in terms of reducing occupancy limits, moving for the most part, on-premises consumption at bars to outdoors, almost exclusively in the state now. And we continue to promote all the mitigation measures that are so important with a mask mandate, for example. And this is basically the same set of restrictions and mitigation measures we had in place that ended the summer surge. So I have all the confidence in the world that the restrictions and mitigation measures are sufficient so long as the people of Louisiana will comply with them. So I would ask that we all do what we can. We play our part and understand that we have an obligation to our neighbor. We don't just pose a threat to our own health and safety when we don't wear a mask and we gather too closely and so forth. It's for all of our loved ones and people we don't even know. That's the nature of a pandemic, and that's what makes it so hard. But Michael, I appreciate your comments. We did take a step back. I think it was 3 weeks ago now. I'll have another meeting tomorrow. It's either tomorrow or early next week because the current proclamation expires December the 23rd, and we'll be announcing a decision next week as to what the next proclamation will look like.
Paul in Metairie, you're on the air with Governor Edwards and Stacey Hall. Hi, Paul.
Hello. My question is probably directed to Ms. Hall, Dr. Hall.
Actually, it's Nurse 65. Hall, but go ahead, sir.
Okay. I'm over 65. I have pre-existing COPD and asthma. Who do I have put me on the list after all the healthcare workers, first responders, nursing home people, and everything?
Where would he be on the list?
Well, you're definitely a priority for an early dose of vaccine. We're expanding based on the national guidance, and yet planning with a whole lot of partners that reach out to people just like you. So we're very interested in working with both the pharmacy chains in Louisiana, the national chains as well, and then with independent pharmacists. We're planning for people that are at home, like home health and dialysis patients, both the staff and the people under those care, as well as for people in the general public that are just at home, with age restrictions or underlying medical conditions that would make them appropriate for vaccine. So no place to register yet. As the vaccine continues to expand, the amounts are limited. We are doing everything in our power to get as much vaccine as we can into Louisiana. Just pay attention to where vaccine is available, and hopefully vaccine will come out quickly and you can be protected. In the meantime, please do social distance this holiday and mask, and I wish you the very best.
James in Longview, Texas. Hi, James. You're on with the governor and with Stacey Hall.
Well, good afternoon, Jim. Good afternoon, Governor Edwards. Anyhow, I had a different sort of question pertaining to the COVID-19 vaccines. As you noted, the Pfizer vaccines are being deployed. Moderna is on the way. My question is, if and when the second and third, and maybe other vaccines come online, will state government employees, first responders, and others have kind of a choice of which one they want to take? I mean, kind of take a wait-and-see attitude, or is that kind of preordained, dictated?
Yeah, I'm going to ask Stacey to respond to that, but first let me just remind people that these are two-dose vaccines, both Pfizer and Moderna. Pfizer, the doses are 21 days apart. The Moderna vaccine is 28 days apart. And they're not interchangeable. So when you start talking about whether individuals have an option, what you do not have an option to do is get your first injection with the Pfizer vaccine and the second one with the Moderna, or vice versa. And then as these two, we already have one online. We think Moderna will come online later this week and potentially be distributed starting next week. But following on, there are other candidates out there for vaccines that could come online, and the degree to which individuals have a choice of which vaccine to take going forward, I'm going to ask Stacey to address that. But James, thank you for calling in again. Appreciate you.
Stacey.
Hi, James. Yes, there are going to be several products in the market. That's not especially unique. We do have that in children vaccines, in the flu vaccine, both for different recommendations, for different risk factors, for different ages, as well as different products that the pharmacy or the physician's office or your healthcare provider would have available. So there are two, like you've mentioned, and then 4 others that are vaccine candidates in development. We're just eager to get more guidance. We're moving ahead with the product we have, the Pfizer vaccine. We're really hopeful that we'll get Moderna vaccine, and we'll still pay attention to what's coming next, and you may see preferential recommendations. So we're watching and waiting and ready to receive and then administer.
Ken in Ireland, we've had people call from several states over the course of 57 shows, and Ken is calling our first caller from Ireland, the country. Good afternoon. I guess good evening to you, Ken. You're on with the governor and Stacey Hall.
Yeah, good evening. It is 8:30 here at night. My question is mainly for Governor Edwards. Good afternoon, Governor.
Good afternoon, Ken.
Quick question for you. No, I have visited your beautiful state a couple of occasions. I actually prefer Baton Rouge to any other part of it. But my question for you is regarding civil service there. Okay? There seems to be a habit forming there. Now, I have tweeted you a couple of times over the last few nights, and I'd say you're saying to yourself, who the hell is this guy? But there seems to be a habit of cover-ups in the civil service within your state. You know?
What about civil service,
and you
Ken?
mandated brief.
What is your question,
There
sir?
seems to be a habit of cover-ups.
All right. I don't know what he is referring to, but he says a habit of cover-ups with civil service, Governor. I'm not sure where he's going, but Your
Well,
thoughts?
I don't either. But if Ken's still listening, I want to tell him that one of the favorite trips that Don and I made was with our oldest child, Samantha, when she graduated high school. She chose Ireland. We took her there for a couple of weeks because she was born on St. Paddy's Day, and she always considered herself Irish, even though we don't have Irish blood. And that just had a great trip. I don't know how to answer his question. I'm not sure what he was getting at, and I apologize for that.
This is Jim Inkster, your moderator for Ask the Governor. We've done 56 of these shows, and every one of them in studio with us has been Jerry Mayer, the leader of Hometown Productions, who is taping it for airplay throughout the state, telephonically, and on television and cable. And he is, of course, a gentleman who's a student of Louisiana law, as I know our listeners are. And if you'd like to join the conversation with Governor John Bel Edwards and his guest, the State Immunization Officer, Stacey Hall, your number is 877-217-5757. And Governor, since we last joined you, there was an election. Record number of people in our country voted, and about 70% of the people in Louisiana voted. And Joseph Biden, the Democratic nominee, won the overall vote by more than 7 million votes. He won in the Electoral College 306 to 232. You are the only Democratic governor in the Deep South, one of the few in the South, and you will be working with a Democratic administration. Does that really matter, or does the beat go on no matter who is in the Oval Office?
Well, first of all, I am gratified that so many people in Louisiana did exercise their right to vote because, we still had the pandemic going on, obviously, but they discharged their what I think is a civic obligation here and around the country, and I think that's great to have that level of participation. My view of this is that in order to do the best we can here in Louisiana, and for me to be the best governor for our state, it's my job to make sure that I have a good working relationship with whoever the president happens to be. I was able to do that with President Obama in his last year in office, which was my first year as governor. Then throughout the Trump administration, had a good working relationship. And I have every expectation that that's going to continue under President-elect Biden and Vice President-elect Kamala Harris. And I did have an opportunity last week to speak to the President-elect for the first time since the election and made sure that he was well aware that we had been hit by 3 hurricanes, one of which was the strongest to ever hit the state of Louisiana, or at least since 1856, and that we're going to have ongoing recovery needs that will certainly extend into his first year in office, and that we'll be looking for additional help. And so I've already started with that process with Joe Biden, and I look forward to continuing to work with him.
I guess you will be the first governor in 2 consecutive terms to have worked with 3 U.S. presidents since Edwin Edwards. In his first 2 terms, he had Nixon, Ford, and Carter, and John Bel Edwards, Obama, Trump, and now Joe Biden. The Attorney General of this state fought the election of Biden in the courts, joining with the Attorney General in Texas and also, I think, 16 other attorneys general, in addition to Landry and Ken Paxton of Texas. Was that a fruitless endeavor, or was that an important move by our Attorney General?
Well, it was obviously fruitless because the Supreme Court summarily decided not to even entertain the pleading that was filed coming out of Texas. And quite frankly, it was unfortunate. Look, I'm a lawyer. I know our courts exist to resolve disputes, but the dispute needs to be real. And if there were real evidence of the kind of voter fraud that has been alleged on a scale to make a difference in the outcome of an election where there's a 7 million vote advantage for one candidate in the popular vote, 306 to 232, I think it is, in the Electoral College, you would think that in all the weeks since November 3rd that they would have been able to produce some evidence of that. They haven't produced any, and I don't know of a single significant court win, state or federal, anywhere in the country. And so it just seems to me that it's well past time that individuals accept the outcome of the election. I mean, that's what democracy is all about. You always have to have a winner and a loser, and the democracy is best served when the loser acknowledges the defeat, gracefully exits, and then works to make sure there's a smooth transition. And we're all served best by that approach. And so it was unfortunate. But at this point, with the Electoral College voting earlier this week, I do hope that we can move forward and then start to unify, because I don't believe our country has ever been as divided as it is right now in my lifetime. And quite frankly, it's disturbing. So I do hope that we can come together and understand that as Americans and as Louisianans, we still have far more in common than we do share those things that divide us.
All right. 877-217-5757 for Ask the Governor, and we will return to the phones in just a moment. But I think our next show, Matt Doyle, our producer, reminds me, is January 20th, which is Inauguration Day, which is a month and 4 days away. And Governor, will you be here or will you be in Washington remotely on that day? Have you decided?
Well, I don't have any travel plans for the inauguration, and in fact, I'm not sure that you're going to have a lot of the big public events at this inauguration that you would have had in the past because of the pandemic and the current surge with COVID. That I don't think most people are expecting to get any better until well after the end of January. So I believe that I won't be in the studio with you likely, but I haven't been since March, I don't think. But again, because of COVID, but I do intend to be here in Baton Rouge and on the phone with you doing that show.
And we'll have a lot to talk about. And anytime a new president comes in, including the one who's president now, there's generally a brief and sometimes a little longer honeymoon period. Should the American people at this point, obviously a divided country, should we as a people unite behind our commander-in-chief until further notice?
Well, I mean, I think so. And first of all, you only have one president at a time. So until January the 20th, that happens to be President Trump. After that, it's going to be President Biden. And I would hope that we can. This idea that there's never a time to govern is just sad, and I reject that. You already have people looking forward to the next presidential election, and some people's number one goal between now and then is to make sure that President Biden isn't successful and so forth. Well, we have to be able to govern and move our country forward and meet the pressing challenges of today, not just the COVID, but on the economy and on education and infrastructure and so many other things. And so I hope we can come together. And I know that it's possible. Our country's done it in the past. We just need to do that. It's one of the things that Don and I pray for every day.
Christine in Mid-City, I think that's Baton Rouge, Mid-City. You're on with Governor John Bel Edwards and Stacey Hall, our state's immunization officer. Hi, Christine. Good morning.
Yes, hi.
Good afternoon.
Good afternoon. This is Christiane in Mid-City. First, I want to thank Governor Edward and Nurse Hall for the amazing work that they have done so far in managing this crisis and the implementation of the vaccination of the population. My question is the vaccine going to be free for everybody?
All right, that's Christiane. What about the cost of the vaccine? Nurse Hall and Governor Edwards, have we determined what will happen regarding people having to pay to be vaccinated?
Yes, and I do want Stacey to follow up if I get this wrong or if I'm incomplete. It's my understanding that there will be no out-of-pocket costs for individuals to access the vaccinations. And so whether it's Medicare, Medicaid, private insurance, uninsured individuals, not supposed to have an out-of-pocket cost associated with the receiving the vaccine. And that's something the federal government has worked really hard on. But Stacey, do you have anything to add to that?
Well, the vaccine is no cost, as you mentioned, and it does come with ancillary supplies, what you would need to vaccinate, and that's been very helpful. If people do have insurance, it's possible to bill your insurance for an administration fee, and then there's no cost for anyone out of pocket. There is a pool where you can then apply for funding at the national level to subsidize the cost that you incurred. But we've heard that Medicare cost would be a fairly significant, and we're really promoting a reimbursement for an administration fee to make sure that the vaccine is going to be so readily available that no pharmacy or no vaccine provider will say, I just can't even break even doing this. So we're eager to see more information nationally, but what we have and what we're hearing right now means vaccines should be accessible to anyone that wants to be vaccinated.
Jake in Lafayette, you're on Ask the Governor. Hi, Jake.
Hi.
You're on the air.
Yes, I had a question for Ms. Hall. For people who have already gotten COVID, have there been any studies showing that they are immune, as in they don't need to wear masks, they don't need to be socially distant? And also, I'd like to ask, as far as this vaccine goes, what is the process for, let's say, you take the vaccine and you have adverse reactions?
Well, the vaccine is recommended even if you've had COVID in the past. And we think that you'll get a better response and better protection from the vaccine than you would from really having the disease. The antibodies seem to last only a few months after COVID-19 infection. So if you have had COVID in the past, you should still stay in the same category that you would be to be vaccinated. You just would fall to the bottom and let people who may have some antibodies on board be vaccinated earliest, but you'd still follow. There is a national program, VAERS, the Vaccine Adverse Event, that you can document, and there's a whole process to follow to make sure that adverse events are monitored and that, then there's a process to reconcile if you have health issues. Most of the side effects from this vaccine are a sore arm, a headache the next day, maybe low-grade fever. We're not expecting serious adverse events. There were 2 anaphylaxis incidents in London, and so now people that have had an allergic reaction to a vaccine or a glycoprotein in the vaccine in the past are not recommended to be vaccinated. The COVID-19 vaccine still needs to be administered even if you've had COVID. And one last thought is you cannot from this vaccine get COVID-19. It doesn't use a live virus, and so there's no way from this vaccine or from flu vaccines to get ill after the illness after being vaccinated.
Governor, as you know, there's some anti-vaxxers out there, and they're poised to pounce. They're ready to pounce on any bad news at all, and there will be some negative reports about this. How do you get around that when you're encouraging people to get vaccinated? Is that an issue, Governor, when we have people who are against vaccinations?
It is an issue anytime. Look, the Internet is full of conspiracy theorists anyway, right? And no matter how baseless, many of those theories gain currency and so forth. So I'm just encouraging people to be selective about their sources of information. Not everything on the Internet is true, and obviously not every source of information is reliable. And I encourage people to look at what the FDA and the CDC is putting out about these particular vaccines and their safety and their efficacy. I did want to touch on something that Jake brought up, and that is, even if you've had COVID and recovered, your antibodies do dissipate over time. There are cases of reinfection, and so yes, you have to wear the mask, you have to distance, and then hopefully you will get the vaccine. I don't believe the vaccine is indicated for individuals while they have an active case of COVID, but once you're recovered, yes, you should be getting the the vaccine whenever the allocation is made to people in your situation.
Ezra in New Orleans. Ezra, you are on Ask the Governor.
Hi there, y'all. First of all, I want to thank y'all for the competent and resolute leadership that both Nurse Hall and Governor Edwards have shown over the past few months that have been hard for the state. My question's actually not related to the vaccine, but about the Sustainability Council that you launched, Governor Edwards. I was wondering if we had any updates on that council and the progress on renewable energy resources.
All right, what about the Sustainable Conference?
I'm assuming he's talking about the Climate Initiative Task Force, which is very important for our future, not just to address climate change, although that's very important, especially here in Louisiana, where subsidence, erosion, and sea level rise are the perfect trifecta affecting our coast. And because we know that severe weather events are actually more frequent and more severe because of weather change, but we also know that we have advantages when it comes to things like solar energy, wind energy. And we also, I think, are best positioned of any state in the country to take advantage of carbon capture and sequestration such that we can really be net neutral on carbon emissions by 2050. Because we have the geologic formations that can hold the captured sequester, I should say, the carbon, but we also have the pipeline density necessary to transport it, and we have the carbon emitters here, as you know, with chemical manufacturing and refineries, and bringing more of those online to produce energy from renewable forms, non-fossil fuels. And all of that's going to be incredibly important if we're going to continue to see investment and job creation, economic development in Louisiana. And it's going to be important right along the side of our traditional oil and gas industry. So all of that is moving forward. I've actually had multiple visits with people who are financing projects and looking to have these projects in Louisiana in the very near future. And I can't get ahead of myself, but I think within the first half of next year, you're going to see multiple announcements. We've already made a really big announcement with a company called Fidelis, capitalizing a project at the Port of Baton Rouge here, where they're going to be making diesel from things like corn and soybean and used vegetable oil. And they're also looking at carbon capture and sequestration as part of that process. And that's a huge investment of hundreds of millions of dollars and hundreds of jobs, both in terms of construction and permanent jobs. And so that's just the tip of the iceberg. I think we're going to do a lot of really good work in this area. And by the way, oil and gas companies are rebranding themselves energy companies because they know that they are going to be investing a bigger part of their capital in renewable energy and in things like carbon capture and sequestration going forward.
Ian in Baton Rouge. Hi, Ian. You're on with the governor.
Hi. So the Louisiana superintendent recently stated that teachers should be a high priority for the vaccine, which means that they are at risk of spread from COVID at their workplace. My question is, if the spread is so dangerous for teachers at schools, why are schools open? And recently we have seen, since schools have opened across the state, the rise in COVID cases have also risen.
All right. What about schools being open, Governor?
Yeah, well, first of all, we are getting requests from all sorts of places, as y'all might imagine, to have groups of workers at the front of the line for the next order of priority for vaccines. And we're certainly going to be looking at all of those requests, following the ACIP recommendations, making sure we have equity, and we're addressing the situation here with respect to those individuals being hospitalized. I can tell you that for the schools situation is one where I happen to believe that there's not a lot of transmission of the disease in the school setting itself, because that is supervised and people are wearing masks and being distanced or washing their hands and so forth. And quite frankly, if you send kids home where the parents are working and they're unsupervised, you're actually going to have, I believe, more spread than we currently do with the schools open. So I don't believe that there's anything about the school buildings themselves that render that unsafe to the point that we need to close them, other than when we have specific outbreaks, and our districts and our schools have been doing that as it has been warranted, and transitioning back to more online instruction until such time as they can bring their kids back for in-person instruction. But it's also important for nutrition. It's important for socialization. It's important because that's where our mandatory reporters of abuse and neglect are. Mental health and other behavioral health services are available at school for the kids that just can't be made available when they're at home and dispersed. And so for all of those reasons, we're trying very hard. And look, all the decisions we make around COVID response are about striking the right balance between whether it's the economy being open on the one hand and public health on the other, or schools and public health, or higher education and public health. And, and anybody, I assume, reasonable people can always disagree about exactly where that line needs to be struck, but we're doing the very best that we can. We're relying upon science and data recommendations that are coming from the federal government, but also looking to the school districts here and other folks with respect to every decision that we make.
We're about to close out the show today, and Governor, we wish you and Donna and family a happy holiday, and the same to you, Nurse Hall. We've got about 15 seconds, Governor, but have you decided how you'll be spending Christmas Day a week from Friday?
Yeah, at home with my immediate family who live with me, and I'm encouraging people to make sure that they are safe this Christmas. And let's look forward to a much better 2021. Let's be thankful for all the blessings that we enjoy. But we've got a ways to go to get out of this. And so let's get vaccinated when you can and make sure we continue to distance, wear a mask, wash our hands, and stay home when we're sick.